It just flies by when you're eating lunch. So here we are.
This meeting is being recorded.
102, almost. So we'll just wait until everybody gets on the video. Waiting on Debbie, Jose, Jason, Ricardo, and Shirley. Jose, I see. Debbie, Jason, Ricardo, and Shirley. I see Debbie. Yes, Ricardo's back.
I'm off the naughty list, song.
Welcome back. I think we're just waiting on Shirley. Hi, Shirley. I see Shirley back too, so I'm going to take a roll call and I'll hand it back to you, Trisha and Sarah. Maria?
Here.
Thank you, Maria. Jig?
Here.
Thank you, Jig. Cheryl?
Here.
Thank you, Cheryl. Jose?
Here.
Thank you, Jose. Shirley?
Here.
Thank you, Shirley. Ricardo?
Here.
Thank you, Ricardo. Nicole? I see you, Nicole. Oh, but her connection might be having a little issue. Okay, we'll come back to Nicole. For her, I don't know why it has an exclamation mark on it. So, Debbie?
Here.
And Jason?
Here.
Thank you, Debbie. Thank you, Jason. And I'm here. I think Nicole, it says due to low bandwidth or local computer conditions.
This is Trisha. If she turns off her camera, that might help. The camera eats up a lot of bandwidth. So if she's having like an internet connection issue, she might,
See.
Yeah.
Do you think she can hear us, or does someone need to text her?
This is Sarah. She should be able to hear us because she's connected. Her audio is connected. Because she is connected on the phone, she's going to have to control her mute and unmute button on the computer WebEx session. So if she's currently speaking and we can't hear her, that might be why.
Hi, this is Anne. I just wanted to let you know that Nicole did have her computer crashed. She's logging in back right now, but she did indicate she can hear us.
Okay.
All right. Sounds good. I think we can get started then. So let's go on with our legislation and regulation section and take it away, Sarah and Trisha.
All right. So like our board president said, we'll be moving on to legislation and regulation. That summary is going to be on pages 23 and 24, and then the survey responses on pages 278 to 364 of that environmental scan. So we'll go ahead and pull up those suggested objectives. And we have 4 here, so we'll look at that first one. Do we have any comments or edits we want to make to this first objective?
My only comment is I feel like reimbursement is not in our swim lane. So I'm not sure if one is, I know this is legislation, this is just advocating for it, but I still am kind of uncomfortable when the Board of Pharmacy advocates for things that really aren't isn't in our swim lane. Maybe we could redo that and just take reimbursement out. But anyway, I just think reimbursement's not in our swim lane.
Or we can maybe say a financial incentive for patient consultation and other clinical services.
Okay, so we'll take lack of.
I think the business of pharmacy, and I know this is kind of a fine line, that's where I think it's, and I just feel like it's not necessarily, when you reimbursement by others that we don't even control, I feel isn't really in our swim lane. So whether we call it financial compensation or reimbursement, that's really the same thing.
Yeah, this is Maria. I agree with Debbie. Historically, and because we're representing the state and the patient, we want the service that is a barrier is the finances and the reimbursement, but that's something that we traditionally would want pharmacy organizations to take on that representation, because we're representing the patient and the need for the services. But the finances and the reimbursement and the operational business aspects, I don't think are the purview of the board.
Yeah, I agree also. It seems like we're advocating just for pharmacies to get paid. And I'm not seeing how the connection is with the public, welfare or us as a.
Well, the public definitely benefits out of it, because I mean, if they can provide this service, and they will only provide service if they're compensated for such, and them being the most accessible professionals, public will benefit to get a lot of more clinical services from pharmacists. They can be rendered at even a retail pharmacy if there was a compensation.
I think we all agree. I think it's mostly as to who should be doing the advocating, but we agree with the concept. But is that the board's scope?
Seem like, part of our scope is to, add on more things for pharmacists and pharmacy techs to do. So I don't know. I kind of see both points of view on a certain level, but we can continue
I think the
add on and add on for things that pharmacists should be able to do, but yet we can't advocate for them getting paid anything more. That's just my
point. That's a good point.
the wording, I think the reimbursement is where it's a challenge, but I think we reword it to regarding funding or grants for patient consultation and other clinical services. I think advocating for grants to be created, or funding to be created by the state, made available for then the pharmacist or the pharmacies to apply for those grants. I think maybe that's the angle that we want to lean towards. Just a suggestion.
I think it doesn't come down to the state providing the funding. This is typically, there's legislation out there making insurance companies or PBMs or do other business organizations to fund things. And typically the board doesn't get into those arguments, because that's really the argument between the business owner and the business, I guess, whoever is paying the business. And while I think sometimes we do support that legislatively, we don't run those bills ourselves. We would work and help maybe the pharmacy organizations to support their members, because it is a valid point, but it's not the state that would be providing the funding.
Then I think this item maybe could be removed then.
Yeah, I think unfortunately it needs to be removed.
Could we talk about it in terms of provider status instead of payment? Would that get rid of the issue? Because provider status
leads to payment, but we could advocate for provider status without talking about money. Would that get rid of the conflict?
That would be in our swim lane. That would be more appropriate.
Yeah, I don't think we need to get rid of it. I don't think that. I think we need to just kind of adjust it.
Yeah, so I think to what Nicole said regarding the provider status.
Maybe talk about the professionalism and being recognized as a provider that is important in the healthcare team or something apple pie like.
Yeah, and the benefit, we have to make sure it's, for, to improve public health or something like that. Or
yeah, I think we can, with the benefit, we could probably also talk about provider shortages. So provider status for pharmacists allows them to fill some of those roles that are falling short because of lack of providers. So it is a patient safety item, or allowing patients access to services that they are going to have trouble getting otherwise.
So I would have to say, I'm not sure provider shortage is something that we have to deal with either, but I absolutely think that we need to get rid of, but it's definitely about improving public health.
How about patient access? I think an accessibility is maybe even better than shortage.
I like patient access.
Mm-hmm.
Improve patient access.
Do we want to keep that remove barriers to pharmacists?
Yes, get rid of that.
Okay. And then for the issue, it was regarding recognition as a provider. Is that what it was?
Yeah, provider status.
Yeah, provider status for pharmacists.
Okay, and then we're going to take out that second half of it. Okay, and then for the action, do we still want consider and advocate, or do we just want advocate?
I don't know. I feel like with legislation, you always have to have consider, review, evaluate. You have to have something there because, it depends on what the bill says.
I think it's fine the way it's written.
Yeah.
Okay. Okay. All right. We all good with number 1 now? Seeing head nods, so we'll move on to objective number 2. Do we have any comments or adjustments we want to make to this one?
Good.
Sounds good to me.
Sounds good to me.
Okay. In that case, we'll move on to objective number 3.
You need to put a comma after update, review, and update if necessary. I got you. Okay, never mind.
Okay, and how do we feel about objective number 3 here?
I think, again, it's a financial component that we need to change in a different way.
Yeah, I know the Department of Insurance is really going after PBMs. I don't think Board of Pharmacy. But, so, yeah, how do we want to tackle this?
It's about access. Again, it's about access, right?
Yeah, just a perspective to share from looking at the environmental scan. It just was overwhelming comments on this. That's why it was kind of brought here. And I think the concern from our perspective could be that they are somewhat providing some sort of patient care without being licensed, and how they're forcing certain pharmacy practices to be in certain way by their practices. I think that's why we were trying to bring this upon our discussion. But of course, open for however we can to fit into what we need to fit into.
Well, aren't pharmacy benefit managers, aren't they regulated by the Department of Insurance?
They're not, Debbie, believe it or not, I don't think they're regulated. They're registered by the Department of Managed Care. They're registered, but there's nobody in the state level that are regulating them. And I think that's why it's been a deep concern on both federal and state levels. And obviously, I'm sure anybody who's following pharmacy news should be aware how it's controversial. So,
I think it should stay the way that it is.
Yeah,
I'm,
and
I'm concerned that we're kind of getting out of our swim lane, to use the term that Debbie said. I think the consequences and the barriers are things that we need to focus on. And if outside entities are creating barriers, we need to deal with the barrier and not the entity itself. It's just not something that is in the scope of the Board of Pharmacy. I think our scope is to access and remove barriers, and not get into who's paying for it, how they're paying for it.
but I think, Maria, that's the discussion that I think is just is a confusing, but also we need to figure it out, is because what if there is an entity that is driving certain practices to happen and that is impacting patients in the world of pharmacy? So are we just going to say that we can't get involved?
Well, I think it's a legal issue. I'm not saying I don't agree with you, and I think individually we would advocate, and as patient advocates, we would work for these kinds of things to assure patients get what they need when they need it, as quickly as they need it. But I'm not speaking as a pharmacist or as a patient. I'm speaking as, working for the state. Is this something that is in our purview? Do we have the legal authority to get into this area?
Well, I think, yeah, that question is where I think we don't know, because obviously, it's the same thing we were discussing, unlicensed activities. If they're providing or intending to provide in certain services that is related to pharmacy, but they're not licensed, but yet they're still doing it. So, I mean, I think that's why this is important, and it's overwhelming. I mean, I know that we can't just do it because it's the environmental scan said, so many people say a lot of things, but still, it seems like it's an overwhelming concern that we need to tackle in some fashion, and we need to at least, and it's not like we're saying that this is what we're going to do. We're just kind of evaluating if we even have the authority. I think if we say we're just going to not look at it, then I think then that's kind of we are undervaluing what we should be doing and how we should be involved in the world of pharmacy. So I think we need to somehow maintain this objective. I feel very strongly about this one. So
I feel strong about
the
it
word
too.
advocate then.
I think it's a public protection issue, and that is that is what we're supposed to be doing. So I agree with what you're saying, Song.
I agree with you too, Sam.
To go with where Sung is going, I think the action needs to be different then. It has to do with evaluate and something else. It sounds like we need a lot more information.
Well, we can just leave it as evaluate. That's fine, I think, if that's agreeable. I mean, I know that Trisha and Sarah will say we need more action item, but I mean, if this is where we want to go, I think we can at least start with evaluating what's going on. So then, maybe next item we can next strategic planning, or next whenever we have any goal updates, we can look further into it.
But I mean, if we're evaluating it, why can't we once we evaluate, that's the whole purpose of evaluating it, to make a decision as to whether it's something we should be involved in or not. What is the purpose of evaluating it if we're not going to do anything with it?
We should advocate. I feel like we should advocate.
Evaluate, and if appropriate, advocate.
So I have one other comment. Do we want to just limit it to pharmacy benefit manager practices? I mean, it almost kind of gets back to what Maria was talking about earlier. because there could be unintended consequences of patient care driven by.
Any entities.
Well,
Yeah.
it's also like white bagging. We're having a whole discussion about white bagging, and right now we don't have any authority, but we're learning. So that's very similar.
Yeah, and sometimes, the practices, I mean, there's a couple of things that come in, because sometimes it's the health plan pushing the pharmacy, the PBM to do whatever. Sometimes it's the PBM's idea. Sometimes the pharmacist has signed an agreement that says, I'll do this. And so then they kind of also need to just not sign agreements that causes it. So I just feel like by pharmacy benefit, I think that's too narrow. I think we should make it broader, because
What do you think that be like a third party entities, unlicensed entities?
Unlicensed.
We should add to the PBM because PBM is the major player that's doing that.
Here's an idea.
Add to it.
Why don't you,
And I agree, Jay.
here's an idea to word it to say barriers regarding barriers to patient care driven by outside entities, and then put EG, and you can list a few.
Is that okay, Tricia and Sarah? Is that not like
To patient care?
Yeah, it's okay to put examples.
perfect?
But I just want to make sure I heard what was said. So regarding barriers
To patient care.
Thank you.
And I was saying something about driven by outside entities. Is that too narrow before your EG?
I think that's fine.
Yeah, I would like to remind that we do want these objectives to be specific. So we don't want to broaden them too much.
But do we need to define outside entities? Are those, once again, like we had up in your thing, Maria, do we want to call them non-regulated entities?
Well, we're not sure. They could be regulated, and we don't want to exclude those.
I gotcha. Okay.
That's actually very good, because entities could mean lots of things. We don't want to say other regulatory bodies. So entities probably does need to be more descriptive.
Do we want to say something about like pharmacy adjacent entities, or like we want to note that there's a relationship between them?
Well,
something like that.
It gets to be kind of messy, because there are pharmacy adjacent entities that are regulatory bodies. So I don't think we don't want to go in that area. Driven by outsiders.
Under EG, can we also put drug manufacturers? Because there's a whole bunch of issues with them as well.
Yeah.
So I think you want to get rid of patient care driven by. I think you want to have EG, pharmacy benefit managers, drug manufacturers. I mean, do wholesalers create barriers?
Well, they're already regulated, so I think. Well, I guess manufacturers are regulated too.
I don't. Yeah. But if they're if they're entities, we're just giving examples, so it doesn't matter. I think wholesalers could also be an issue. I think TPLs are third party.
Logistics. Mm-hmm.
Yeah, TPLs, I think they could be an issue, but I'm not sure we have to list everything. I think we just gave a couple examples. I think that might be good enough.
And for the benefits, should we specifically add specialty medications to it?
I support that, yes.
Yeah, because specialty meds are going to be the future, and 30-40% of those prescriptions are going to be specialty within a decade, and that's a big deal right now.
But do you want to limit it just to specialty? I'd rather have it be.
I want to add specialty to prescription, basically. Like prescription meds.
Limit it to prescription, though. Why not just say all medications?
Yeah, I think it should be all medications.
Well, I think it's good to call out special. Because that's where the controversy lies the most. So
That's what the manufacturers and PBMs are playing, and a consumer has to go out of state or mail order only, and that's a big problem right now. And I think we should list specialty in there because the large percentage of medications are going to be specialty within, like that, say, next 10 years.
Well, I think it's formulary too, and that's all drugs.
So
Do
just
we,
how about leave it like it is then with prescription and specialty medicines?
Well, but specialty medicines are prescriptions.
do we want to say prescriptions, including or especially specialty medications? And I would put specialty in parentheses as a acknowledgement that it's defined by whoever is making the definition. There isn't a solid definition of what specialty means.
That's a little controversial because it is a term, a medical term now.
Right, but the PBMs and manufacturers and others all create their own definition. So we want to acknowledge.
It comes from the FDA.
There's a CMS definition and an FDA, but that doesn't mean that that's the definition that the PBM is using. They can set their own.
Right, exactly.
And that's what the problem is.
All right, so it feels like we have come to a consensus on objective number 3. All right, so move down to number 4. And then I think we can spell out KSA again, which was knowledge, skills, and abilities. All right, and do we have any edits or comments on this one?
What do you mean by points of care? Points to care? Access points to care. What does that mean? Does that mean pharmacies or does that mean everything? Doctor's offices? I'm just asking.
I think what this is trying to say, Maria, is to just kind of advance what a pharmacist can do wherever there may be. So increasing that point where pharmacists can practice and perform.
I'm a little bit lost because pharmacists can practice anywhere.
Well, but I think we're trying to increase.
Okay.
With this, when I'm reading this, I'm kind of imagining some of the furnishing protocols. Is that kind of what this refers to, or would those fall in this area?
I'm gonna see what Ann. Yeah, go ahead, Ann.
Sorry. Yeah, I think it could be a couple of different things, but I think when we're talking about, creating additional, so it's really when I read create appropriate access points to care, I'm looking at the touch point for the patient to be able to get the health care that they need by a pharmacist where it's consistent with the pharmacist's KSA. So that may be in a pharmacy, right, because the patient is already going there for other services, and so they're leveraging that access point to also get this additional care that they otherwise would not have access to. I hope that's helpful.
Does that make sense, Nicole and Maria, or are you guys okay, or do you want to change?
I guess I'm going to be curious to what the public comment is going to be. I just don't know what that means. But maybe that's purposeful to be broad.
I like it generally. I'm imagining it being how we can allow pharmacists to do more testing, more furnishing protocols, like more of those sort of things.
You're right, Nicole. Yes, that's my.
Okay.
I think that's where I think the intention is. So.
Yeah, it's kind of related to number 1, but it's slightly more without getting the provider status, still allowing us to do those things. And in some of those rural areas, places that don't have a lot of access to healthcare, I think this is super important.
Okay, I think, and then we're ready to add on the 3 that was suggested by the. Oh wait, there's more. Sorry. Go ahead. Yep.
Oh.
Go ahead, Anne.
Anne, you are muted.
I'm just going to keep talking on mute. I'm so sorry. I just wanted to, I don't know if it's appropriate, Nicole, and I apologize if I'm misspeaking here, but I'm feeling a little bit like number 2, if you feel comfortable going back to that, that might be an opportunity for us to kind of broaden the intent of number 2 with respect to our regulations, and updating it is not only to, I mean, I guess we could look at it as keeping current to also reflect, you know, other types of changes, or if you feel like we should be adding in a specific statement based on some of what Nicole brought us in the prior discussion. So I just wanted to throw that out. Sorry if I'm misinterpreting what you were looking for.
But Anne, wouldn't that then, I mean, number 4, what we were talking about is just around the pharmacist. Number 2 could be broader.
This was the earlier discussion, I think, about people who are non-binary and pronouns and that piece. Is that what you mean?
Yeah, that's what I was kind of referring to. It feels like we could maybe leverage number 2 and maybe incorporate kind of what you were looking for there in this specific objective.
Perfect. Thank you for pointing that out. Yes. I don't know how to say it, but.
So I would probably not limit it to just regulations. I would probably add in statutes or existing pharmacy law and its regulations. And then the benefit is not only to keep it current, but also to ensure, I don't know the appropriate terms, but inclusion for all or something along those lines, because it's not only for our regulated public, but also for our patients and everything else. So making sure that it's broad enough to reference, you know, or encompass everything.
Okay, so we've added 16 regulations and statutes, and then for the benefit, Tricia added in current and inclusive for all. Sound good?
Yep.
Okay, I'm gonna delete my note about that going in organizational development. So these 2 right here, these are actually those suggested objectives from the environmental scan. We went ahead and put them in. There were 3, but one of them was exactly the same as on the previous slide, so we just almost word for word the same.
Seemed like number 5 would be also captured in number 2 once we have the meetings that we have proposed to have pertaining to empowering licensees.
I think you might be able to combine them, but I like the idea of it being separate because it's not just keeping regulations current, but it's talking about going to the next step.
It's scope of practice. Yeah. I like it separate.
And I like that we actually used the term scope of practice because that really has a big target on it.
But do you think the benefit is to empower licensees? I think it's more, I mean, the benefit should be, I mean, it's to help the public, really, at the end of the day. It's not to.
Yeah, to
absolutely.
To increase access.
Mm-hmm.
And quality. I don't know what another word for that.
Yeah, quality is good. Access and quality of care.
Well, that's another target because it implies that there's not quality now, but I'm thinking there's another word for quality.
It says increase quality.
Well, improve quality is fine, I think. Yeah.
Okay. Increase access and improve quality care for the public.
We could do improve health outcomes.
Yeah, that might be. Oh, there you go. Thank you, Nicole. That's. That's the ultimate goal.
We need to make sure we say it's for the public, because that could be perceived that we're improving health outcomes for them. You know, PBMs, health plans, whatever.
Okay. So we'll move on to objection number 6. Any comments on this one?
I just like to say I like it being here.
I like the concept. I think it needs some wordsmithing. So is that something that maybe Anne and Sung can work on the wordsmithing? Because appropriate help is just too broad. I think we need to say what that means.
I think we can figure this out.
Are we talking about staffing, or what kind of help are we talking about?
I think this is over, you know, encompassing everything, including additional, you know, adding duties, maybe staffing, maybe changing, you know, allowed activities.
So,
and I think it's
so
also the quality of the help, because you know, you don't want to just take the meat man from whatever. I'm trying to pick a company that won't upset people, but from wherever, and stick him in the pharmacy to help you out.
Right. Nicole, what were you?
They're appropriately educated or trained.
Qualified help.
Yeah, there you go. Qualified.
I was going to say maybe use the word resources. That pharmacists are provided with
Qualified
appropriate resources.
Yeah.
Because it sounds like we're thinking about not just staffing, but a whole variety of resources for practice. Yeah.
I like qualified though instead of appropriate.
I would suggest wordsmithing the benefit though too, also to improve working conditions to protect consumers. What do you think about that? It changes the tone, but
no, I think that's great, Maria. Yeah.
Okay, I'm just going to say this. I don't want them to get mad, but I feel like, are we supposed to be improving working conditions for the pharmacists? I mean, I'm all for this, but should this just be to protect consumers? Is it okay to say working conditions?
Well, I think maybe it could be wordsmith, but I think the idea is when you have improved working conditions, you have less errors, and you have better quality pharmacy care. So that's what I think the goal is, but how to word that.
How do you do? I like what you just said, to improve pharmacy care.
You can get really wordy and say to improve working conditions, to minimize errors and provide, what do we call, increased outcomes? We could use the same terms up there. I like the idea of calling out working conditions, even though that's kind of a gray area for us, but it is directly linked to patient safety.
Yeah, that's exactly, I think, why that this was even, well, anything that came upon at the end of the session as possible objectives, meaning they were, again, it's just because people are saying doesn't mean that we have to incorporate it, but they came here because they were overwhelmingly expressed in the survey in many comments. And so, you know, we gotta somehow incorporate it, I think.
I think it should stay there.
Okay, so one other thing, do we want to just, it's not really only about minimizing errors though, is it? Improve working conditions. I mean, it's almost just to improve working conditions and improve health outcomes for the public. I mean, there's a lot of things that hopefully
I agree with that.
Hopefully it fixes errors. Hopefully it fixes, you know, the pharmacist access. Hopefully it improves the quality of care.
I agree.
You know, I could go with that, but somehow in the back of my mind, I like the idea of calling out minimizing errors because it kind of calls it out right away. Poor working conditions hurt people.
I think we can keep most of this. Why don't we do to promote working conditions that minimize errors and improve health outcomes for the public?
There you go. I like that.
I do too. That sounds good.
Thank you, Nicole. I'm really glad your computer is not crashed and you're back here. Thank you.
Did we have any? Oh, I apologize. Go ahead, Tricia.
Sorry, I just wanted to make sure, Nicole, that I caught what you said. So if I missed anything, please let me know.
That was perfect, and thank you. I apologize for my computer. It likes to do it once a day, and it's always at the most inopportune time.
Mine always likes to reboot and update right in the middle of a conference call. It's like, really?
All right. Did we have any additional objectives that we wanted to come up with at this point? Take the silence as a no. At this point, do we want to make the motion and then move on to public comment? All right.
All right. Anyone wanting to make a motion? I think I made the last two motions, so hoping someone else can make the motion.
I would make the motion.
Thank you, Cheryl. Go ahead.
Okay, let's to proceed with the 6 actions for ledge reg that we proposed.
And delegate to the board president and staff the authority to make any non-substantive changes to the language, right, Cheryl?
Yes.
Okay.
And I would second that.
All right. Thank you, Jose. Thank you, Cheryl. All right. And we're going to go for public comments.
All right. At the direction of the board, I have opened up the Q&A feature for public comment. Members of the public, if you would like to make a comment on this item, please click that Q&A icon located at the bottom right-hand corner of your WebEx screen. All right, and looks like we do have a couple individuals who have requested public comment. So give me one moment while I get my timer up and running. We'll go in the order that comments were received. So we'll start with Danny Martinez. Danny, you'll be given 3 minutes to speak and a 10-second warning. I will request to unmute your microphone now.
Can you hear me?
Yep, you are unmuted.
Thank you. Martinez with the California Pharmacists Association. Could you go back to the first slide where it lists 1, 2, and 3, I think is what it was, please? Thank you. I wanted to say for objective number 3, I do believe that advocate is absolutely appropriate for the board to consider. And I want to, there's a whole lot of things that PBMs and other entities do that I can go all day about, but for purposes of the board's mandate to protect patients and consumers, I want the board to really understand this. There are entities out here who are not pharmacists, who aren't even healthcare professionals, who are making decisions based on whatever information they have that's financial or otherwise. They're actively deciding who gets drugs and whether they get drugs. These are people who are practicing pharmacy without a license. And so I cannot think of a more paramount reason that the board would not advocate on these types of barriers that these types of entities, mainly PBMs, do, because they are, in effect, practicing pharmacy. Any other professional in this state who has a pharmacist license has a duty and a responsibility to make sure that patients are getting the most appropriate drugs at the most appropriate times. These are not entities that do that. And so I do absolutely believe that the board should be advocating for these types of changes. And I really hope that the board I'm hoping to drive this point really hard with the board, that just because a PBM may or may not decide a financial aspect of a pharmacist reimbursement, they are actively practicing pharmacy. Thanks.
All right, we'll move on to our next individual who has requested public comment. individual identified as John Gray. John, you'll be given 3 minutes to speak and a 10-second warning. I'll be requesting to unmute your microphone now. All right, you are unmuted.
Hi. Great. Thank you. Thank you for the opportunity to comment. Good afternoon. This is John Gray. I'm a registered pharmacist with Kaiser Permanente. The board has discussed a few times today the fact that pharmacists practice in a number of different practice settings. And so I just have one suggestion related to item number 6 in this section, and that is that, as the president and the executive officer review this and potentially refine the strategic plan, we would suggest considering whether item number 6 should address the resources that are available to pharmacists in all practice settings. So thank you very much for the opportunity to comment.
All right, we'll move on to our next individual who has requested public comment. Daniel Robinson, you'll be given 3 minutes to speak and a 10-second warning. I am requesting to unmute your microphone now. All right, you are unmuted.
First of all, item number 1 said that it addresses pharmacists as providers. Well, in California, pharmacists are already recognized as providers. And but what is missing is the regulatory environment that allows that fully supports pharmacists as healthcare providers. So I think part of legislation and regulation should really be looking at, all of pharmacy law and any barriers that prevent pharmacists from practicing as providers of healthcare services, such as ordering laboratory tests. When it comes to some of the medications that pharmacists are furnishing, there's all these stipulations and requirements as if we're working under a collaborative practice agreement or as a physician extender. We are health providers and we're fully capable of doing these things with outside of a protocol. And the other issue is, I think that we could cover a lot of these issues if we remember that the Board of Pharmacy can serve patients in the state of California by removing unnecessary barriers between patients and services provided by pharmacists. So we talked about PBMs. Well, you don't have to mention PBMs by name. You can just say what we want to do is remove barriers between access to pharmacists and between patients and pharmacists. The same goes for reimbursement. If pharmacists aren't being reimbursed for services they could be providing, that is really a barrier to providing those services. So while we don't have to specifically say we're advocating for reimbursement, that should be a consideration in our legislation moving forward. Thank you very much.
All right, it appears that was everyone who requested public comment. Would you like me to close that Q&A panel?
Yes, please. Thank you, Sarah. And with the public comment, any other member comments before we go for vote? All right, we are going to go for the vote, starting with Nicole.
Yes.
Thank you, Nicole. Debbie Veal.
Yes.
Thank you, Debbie. Jason Wise.
I will have to abstain, Song.
Oh, yes. Thank you, Jason. Sorry, I forgot. Got carried away there today. Maria Serpa.
Yes.
Thank you, Jig Patel.
Yes.
Thank you, Jig. Cheryl Butler.
Yes.
Thank you, Jose De La Paz.
Yes.
Thank you, Jose. Shirley Kim.
Yes.
Thank you, Shirley. And Ricardo Sanchez. Ricardo.
Ricardo, you're on mute.
Ricardo? Oh, Ricardo's muted. Ricardo, how do you vote? Oh, he might not be hearing us. Okay, we can move to Myself, I vote yes, and the motion passes.
And you voted for it too, correct, President O?
Yes, I voted yes. Thank you, Eileen. All right, we're moving on to the next. I'm turning it back
I'm sorry,
to you,
I
Sarah.
wasn't sure if you got my yes vote there.
Oh, thank you, Ricardo. Got it. Thank you. Ricardo votes yes. All right, moving to next. Communication and publication. Back to you, Trisha and Sarah.
Thank you. And I've given Sarah back control so she can type and we can do the role reversal again. So summary on pages 29 through 30 and survey responses on pages 365 to 429. We'll go ahead and take a look at some of the pre-worked objectives. So starting with that first one, is that something that we want to keep?
Yeah, I'm looking at all of this. Such a great committee. I would say we just approve it all and just move on down. We'd be fine.
Yeah. Thank you, Ricardo.
No, it's actually, I'm looking at some of these, and I'm also looking at some of the external stakeholders, board members, board management, and staff, and everybody seems to be with high percentages as far as the job that we're doing in communications and public education. But yeah, it all looks good.
Great job, Ricardo.
I just have a question about number 4. Create an educational program for interns. Can you provide any background to that song?
Yeah, I think what that one was about, Debbie, was first of all, there's a little bit of, I think it tying everything together, starting with, what happened 3 years ago, or is that 2 years ago? I think that was, anyway, with a little scandal we've had, and then also just kind of incorporating into how we can ensure that our interns are trained and be ready to practice with highest level of integrity and highest level of education. I think that's where this came about, and also to make sure that our interns, basically are ready to be a pharmacist. We just wanted to kind of add more layers to it, just because we saw some past historical issues with maybe integrity problems or whatnot. So that's kind of where this came about.
Well, so I'm wondering, because we lean pretty heavy on ACPE, so I'm wondering if maybe that issue is we need to be working with ACPE closer to fill that gap versus trying to create an additional educational program that kind of layers over. Because a lot of the things you mentioned is actually the responsibility of ACPE.
And do you want to add on to it? Go ahead. Yeah.
I think that one of the things that maybe might be a nice benefit or outcome of this is interns are going to have a lifelong relationship with the board. So even understanding we all know who the DMV is, right? We have a lifelong relationship with the DMV as long as we're driving a car. But I'm not quite sure that maybe those same, there's an understanding of what the board is, why we exist, and how important it is to recognize the relationship that licensees have. And so I think part of it is trying to help establish that relationship at the beginning of their career, as opposed to maybe later on when it might not be under the best of circumstances because of an investigation or something else. So I think part of it is also kind of establishing that relationship early on. Sorry.
Can we do it through is your vision we would do it through the colleges of pharmacy? Because I just feel like this could get a little bit messy, because I think you have the colleges of pharmacy that are, educating these students. We have ACPE I understand, but some of the stuff that we talked about is really ACPE. But I understand where you're coming from, but how do we get to them? It seems like we almost have to do it from colleges of pharmacy. Are you going to try to require something as part of their intern license or?
Well, I mean, I think, Debbie, you can think of it as anyone who's a pharmacist who's getting continuing education credit every 2 years, they're required to take an ethics course, right? It's kind of like that. Maybe is there something we can do for the interns and to kind of set a better standard of them understanding what we do? I mean, we are in
I
one of the most
understand that
unique.
part, but I guess how are you going to push it out? Because I mean, we could spend a lot of time creating this program, and I know Ricardo runs a very good committee, but I mean, how do we really entice them to do it?
Well, I think we have a great opportunity because like what I was saying is we have a very unique situation. I think we're one of the very few that students are almost required to come across us at one point in their education. So it seems like there's an ample opportunity. We have a lot of touch points. It's just we need to add more information during those touch points so that they are better educated on what we do and where we are so that, they can have a better understanding on the pharmacy, regulations.
So, and I know we started to reach out through the colleges to like the first years, and I think your kind of a focus is reach out to the first years, reach out to the fourth years. Has that been embraced?
I couldn't hear the full question. Was that, has it been embraced?
I said we had a program where we were trying to reach out to the first year interns and then the fourth year interns, like as they are graduating. And I think we were offering it to the colleges of pharmacy. Has that been embraced?
Some schools have done it. Others have chosen not to. So I would say those schools that have given us positive feedback, but not all schools do it.
So, I mean, I guess, are we going to try to, once again, kind of mandate, like force it? Is that an idea?
I think there's nothing wrong with us adding to create an educational program for interns. I don't see what we have to lose with that.
Yeah, I agree with you, Cheryl. I'm just trying to understand. Maybe I'm getting too much in the weeds because I think we've created
Debbie,
something.
let me help you, Debbie, because I think I see a hybrid kind of event here, that there be an educational program and that's something that would be available through the schools, but also some sort of, because the educational program is not something that we can mandate, but we could mandate some sort of, in order to get your intern license, you listen to a 1-hour webinar, kind of like a CE, and you have to actually listen to it. And that would be the required part that would be based on the intern license. But the educational program working through the schools, I think is important. But the problem is, like Ann points out, is you can't require the schools to do that.
Yeah. All right.
That's where I'm at with it.
All right. So you and I are on the same page then, Cheryl. Okay. Because we've tried the first year thing. It's kind of hasn't.
And we both worked with ACPE, so yeah, I'm just saying we don't have anything to lose with this.
And we've had a really good relationship, with the colleges and public and also our licensees. I think our staff at the pharmaceutical board have done a fabulous job reaching out, and all of you see what they've been doing every month. Every time we give a report, they're very active, and we could keep improving on it. I know this is a for the future that we could shoot for, but as we go along, we could always improve and share some of that feedback.
I mean, if in
How
that
about
case,
we push it a little bit more though, by actually putting it more in the issue?
Yeah.
So we would actually push it, because otherwise we'll just keep going in circles.
Yeah,
So,
I just don't know how much we could push though. If you say we can't, make them do it.
Well, why don't we say create an educational program or additional requirements or additional requirements for interns?
Yeah.
So I would like to actually do both. So an educational program for interns that would be coordinated with the schools, and consider required training for interns to obtain their, for interns, or, you know,
For pharmacy
as part of the
students to
application
obtain-
process.
For pharmacy students to obtain their intern license.
Yeah.
Okay, so it sounded like
So make it a requirement.
No, the first part is an educational program through the colleges of pharmacy, because that's something that we can't mandate.
Okay, so through the
An educational, yeah.
program through the colleges of pharmacy.
And I don't know if what the word would be, the verb, consider, move towards, some, because this would require a lot of effort. Mandate, this is probably regulatory change, but a required training prior to obtaining intern license. How did you say it, Debbie? You said it nicely.
Yeah, required training. Well, is it training required program prior to obtaining intern license?
So I kind of see it as like a little 1 hour CE that the board would
Yeah.
put on their website, and you get that certificate and you would just turn that in with your application, boom.
All right, so does that look like we captured it?
Good.
Yeah.
Okay, and then how about the benefit? Does that benefit capture what?
Yeah, I think it spells it all out to ensure the
Okay.
understanding of the board and consumer protection mandates.
Okay. So these are the 4 pre-written objectives, and then there are also objectives, possible objectives that were listed in the environmental scan report. The first of those I can read is increase
Give me
outreach.
1 second, I can copy those over.
Okay, that'll be faster, yes. Or while you do that, I could read it. Increase outreach and education to the public and licensees to promote the profession, enhance consumer protection, and give the board a bigger presence. That was the first one. Second one is create more webinars to post on the website to disseminate basic information. And the third one is improve communication to licensees by personalizing it and decreasing verbiage to encourage licensee engagement. So we'll wait till Sarah gets those pasted and you can decide whether to keep any of them.
WebEx isn't letting me select. So
Sorry.
Let me see if I can, I'll just paste it there for now. We know that's the benefit.
Right. Yeah. So I'm sharing. Oh, go ahead.
Go ahead, Tricia.
Oh, I was just going to say, so I have this PowerPoint open on my computer and I'm giving Sarah permission to type in it. It's a lot easier for me to type in it than it is for her. So that's why she's struggling some.
It just does not like me selecting that third column.
Yeah. But we know where those, the benefits go. So that's okay. All right.
I just want to say,
I just think when it says
ahead.
increase, I mean, our people do a fabulous job getting out there. You know, Ann and our staff, they do a fabulous job getting out there, and they are busy. All of you see the work that they're doing, all the presentations they're giving, and then it says increase. It almost seems like it should say, well, actually, yeah, I guess we can say we're shooting for something. So never mind.
Okay.
Increase.
That's related to number 1. Is it similar?
Sorry, what's that, Maria?
If that first item is similar to number 1 on the previous slide.
Yeah.
Okay, we can go back there in just a moment.
I wanted to kind of bring up the idea in this section, and it might fall to certain points of this, or it might be a more general. what about the use of social media? It's not something I've seen from the board, but the Department of Public Health was doing it during COVID, and it was one of the best ways I got information. It would be a great way to reach both consumers and licensees and really like bits of information instead of these long ones. Is that something that's not allowed, or?
No, we are currently incorporating all of that. We are with staff. These are some of the issues we have discussed with the board and some of the items that we have actually implemented to get our message out using the web, social media. So.
Yeah, Nicole, there's a presence, I think, both on Facebook and we tweet. So what you see email also gets pushed out through tweets and Facebook too, right?
Yeah.
I think that the Facebook is probably through the department.
I know we were having the staff look at all of the social media outlets and also seeing which one would actually benefit, and I just can't recall right offhand which ones they actually came back with.
Yeah,
but
we currently have a Twitter
that
account.
that was one of the issues that we did discuss is how do we get to the public for public safety? How do we get to our licensees to get them the information right away? How do we get these emergency notices out to the public and also to our licensees with fires, earthquakes, and all that sort of stuff? And it was very important during the pandemic and also during the fires when California was going through that. So that's why we came up with that, or we discussed it.
Great.
I'm sorry, Ann.
Something else I wanted to kind of mention in this area as well was, it's almost like we separate the public and the profession, and the only interaction the public is brought into is if there's something bad, if there's a problem. Could we perhaps, and this might be a great place for social media, allow the public to give a hero award for a pharmacist who did something above and beyond? It kind of creates the link between them in a positive way. We did something similar with our client advisory board, where not only are they telling us what we need to work on and improve, but they're also calling us out and telling us things that have gone well, so then we can use those to replicate. And it kind of changes the tone of the interaction. It made a huge difference for staff of not feeling like they were being attacked. And I saw the environmental scan, a lot of feedbacks of pharmacists feeling like the board is punitive. Allowing there to be a positive input from patients might help to change some of that perception and increase the use of the Board of Pharmacy and contact by the public.
That's a great point, Nicole. I mean, Anne, is it something that's possible for us to actually have like a compliment, line or something that we can publish on the script with a story? Yeah, go ahead, Ricardo.
I was going to say on our website, we do put up information for not only for the public, for our licensees. I mean, we are talking about working with the public and the industry itself, even billboards. We had the billboards up that we had one of our board members actually donate to the state, and those gave on information on how to dispose of grandmother's drugs and so forth. So there is a lot of that interaction, and we do try to put it all up on the website. It just what we try to do is not to get it lost, though, because you go to the website and naloxone is the most important thing for 1 week, and then the next week it'll be something else, or next month or whatever, whenever we have a meeting. And you can only put so much, and you want to have such a great impact where the public is actually benefiting from it, and also our licensees are benefiting from it by being able to get the information that we're trying to convey to them. So we're trying. We're always open for ideas, and we'll bring it back to you guys every time.
I really like Nicole's suggestion. I think in the places that it could be implemented, is almost in those point of sales or even those posters that are going into those pharmacies, right? Where we've talked about QR coding and maybe, a section there where, tell me something good, right? They're being serviced at that point of sale. And that's the interaction that they want to probably report, not only the negative of what's happening there, but the positive. So I think, highlighting a way for them to interact back with us with the positive experience and then the acknowledgement to go back to that pharmacy. I really like the idea. I think it's just how do we include it into some of the other activities that are taking place.
So
yeah, I think there's a lot of information to be gained from the positive. When you just make it negative, you get information, but the positive tells us where to direct attention as well. I think that would be a great way to use social media. It can be a super quick, like, hey, kudos to this pharmacy. They saved this patient by catching this thing or providing them an EpiPen, or, whatever it was. It can just be a super quick blurb. That's a great way to use social media.
But yeah, I think let's see what Anne has to say. Go ahead, Anne. You just speak. Don't have to raise your hand, Anne. Just speak. Okay.
So I think I'm understanding where you would like to go with some sort of recognition thing. I think that I would probably maybe we capture the essence of it in kind of a general thing. I feel a little bit like I need to confer with counsel on some of this. And the other thing that I also want to talk about is because we are a government entity, everything that is published by us resides, right? And so we could be setting something up for a specific purpose, but there could be some downsides to that because we would not have control over what people are posting. So it could become the tool that's intended for good could be used for malicious purposes, and then we may be caught in a tough situation where things are being posted that are maybe not true. And because we're a government entity, I'm not quite sure what our options would be in terms of remedying that. So maybe it's coming up with some sort of the action is consideration of a recognition program for pharmacists, something along those lines, keeping it kind of high level. And then we can then maybe talk through, as we're looking to implement the objectives, the different ways that we can do that, where what we don't want to do is develop something and then have it be used for a different purpose that's then actually going to cause harm, right? So I'm a little nervous about a little bit of it, and I feel a little bit like I need to understand some of the rules of the road as a public agency, what we could and could not do if someone abused something.
Yeah, I think
so.
And
I like the. Oh, go ahead.
Sorry. I was going to say, I think we just had a little bit of that with some of the anti-vaxxers that were sending us all literature and were asking us to perform our duties as directors and so forth. That wasn't too long ago, right, Ann? And
yeah,
talk about an example that it could just hijack the whole what we're trying to accomplish, or at least have a sensible debate on it. And that was just.
I think
I wanted to point it out.
It could be set up like any other, path where they call in and complain or they send an email to complain. It's just a digital path for them to voice positive interactions and, potentially a path for us to recognize those that are going above and beyond, right? And I think that's what I would be, leaning towards. Absolutely. I mean, social media, it's a double-edged sword. Make it work for good, and it could be used right, against us too, right? In a way that we can't foresee. So I think just, keep it high level. I think in the committee, it could be picked up and then it could be evaluated by council, see what could be implemented, what cannot, as, as the details evolve. But I think using technology, using, the tools that are available to interact and, not only, with, those, that we're used to, but we have digital natives in a whole new audience that we need to engage and capture, and they're not visiting the website to consume that information. They're using their mobile phones and they're using it at the time and presence of when they consume a product. So I think we just need to look at how we engage those individuals too.
Yeah, I think Nicole has a great point too. I mean, I like some of that, and we could maybe take it back to staff and have them give us some recommendations and stuff. Let them study it and see how we could best, implement some of that. That's what we've always done in the committee, is basically take whatever ideas we come up with and see what they can make out of it, and then come back and brief the board, and then we can, discuss it and so forth. But I do like that, Nicole.
So are we in agreement on these goals that we have so far? We have 8. It looks like the last one is added on. So
it looks like a great thing to go forward.
I'd like to look at number 1 and number 5 to see if there's any crossover.
I think there is, and thank you for saying that. I think 5 and 1 are actually quite similar.
They might be 2 distinct points that we still need 2 points, but I think that they probably could move a few of the words into one or the other.
I think those can be merged, and it might be just an accident on us creating something and then not realizing maybe it was there on the. So
no, I'm okay keeping them separate, because the consumer education campaign, I think, is important enough that it should stand on its own and not be mixed in with all the other educational activities. Maybe the things about in number 5 regarding consumers could be moved up there.
Can you flip to 5 just so I can read it again?
Because the increasing outreach to the licensees is kind of a different issue than the education to the public.
So maybe in 5, Maria, we just take out public. So 5 is communication to the licensee and 1 is communication to the public.
I think that would be
Well,
great.
Then you got to move the benefits, promote the profession, would be to the public, right?
So let's go back up to 1.
Not to be a pain in the patooka, sorry. Look, I didn't raise my hand, Sung. I just jumped in this time.
Thank you,
I don't know if I think we need to maybe look at the word promote the profession. I think we're here to promote consumer protection, so maybe it's educating about the profession, right? Making sure consumers know everything that pharmacists know. I don't know. Sorry. Okay, there you go.
No, you're absolutely correct. I actually was gonna say something about that, but then we got lost in the number 8 discussion, so I kind of forgot to bring it up. But yes, I think we need to say that.
Well, so I still think we take the public part of 5 and put it up in 1. So the education about the profession would go up into 1, and 5 would be about educating the licensees. And I mean, Ricardo, you can speak to that. There's always stuff we need to be educating the licensees about.
I'm sorry, can you repeat that? It kind of broke up.
I'm just thinking that 5 can be more of a focus on the licensees and educating them. And so we don't need to educate the licensees about the profession, but we need to, educate them that their focus is consumer protection, give the board a bigger presence, and then the education about pharmacists, maybe we can move that up into number 1. It's too bad it's not 1 and 4, so we could be looking at them on the same slide. But
yeah, so that means
it's not a big deal. I mean, maybe I'm overthinking this, but it seems like 1 should be about licensee and 1 about the public. That's all.
Give me one moment. I can put them both like back to back on the slide. Maybe that'll make it easier.
Well, if the slide will cooperate with you.
We'll see if it does.
Right.
Let me see if this will work. Nope.
Go back. No.
Oh my goodness.
I got erased.
Okay, hold on.
That's okay. We can, Sarah, we can adapt.
Okay.
That's okay. Yeah. I think it's, and we can actually let Anne and Sung separate them out, because the benefits are getting mixed up and they can put it in the right box.
Yeah, absolutely.
I'll put a note here then that says potentially combine with.
5 is focused on the licensee and 1 is focused on the public, and then you guys can wordsmith.
Okay.
And
It's all
this one
based on
is
what we do anyway, so
Yeah.
same message
focus
pretty much.
on
But
public.
Thank you. All right. So then are we good with these 8?
Anyone willing to make a
Take a
motion?
look at number 8 real quick again.
Sure.
Go ahead.
Yep.
I think the benefit to help build relationship between the public, licensees, and the board.
Okay. So have the
Yeah,
3.
because it's directed towards that consumer.
Okay. So the public, comma, licensees, comma, and the board.
Sorry, I'm trying to click and it's just not
Sorry.
cooperating with me.
Darn technology.
I think it's because the screen I'm looking at is bigger.
Okay.
And okay, between public, comma, licensees.
Right.
There we go. Yep.
Thank you. All right. But are we good with these 8?
All right.
Well,
Jose, do you want to make a motion?
Wouldn't
Go
the
ahead,
first,
Ricardo.
wouldn't the first part of 8 also have to be changed as far as the issue for the benefits? I mean, you're putting public, licensees, and the board. We can program for the pharmacist. Never mind. That's fine.
All right. Anyone want to make a motion? Ricardo, do you want to make a motion?
Yeah, for my
Thank
own
you,
thing.
Ricardo.
Yeah, sure. That's the greatest committee around, of
right.
course.
Thank you, Ricardo. Anyone second for Ricardo?
I second.
Yeah.
Right.
I
And
second
then the
to
motion.
Ricardo.
All right. Thank you,
Just
Cheryl.
to
And the
confirm,
motion.
the motion
Yes.
is to approve. Okay, sorry, go ahead,
Yeah.
Sung.
Oh, no. Sorry, Ann. I was going to say the motion is to approve the goals as displayed and delegate to the board president and staff the authority to make any non-substantive changes to the language. Does that sound good, Ricardo?
Yes, sounds great.
All right. And was Cheryl, right?
Yes, yes.
Okay. Thank you, Cheryl. All right. We're going to open for public comments.
All right. So we are opening up the Q&A panel. If any member of the public would like to make a comment on the school area, please type, I would like to make a comment using the field in the lower right-hand corner of your screen and submit it to all panelists. We are displaying instructions. And then I will let Sarah let me know if there is anyone who wants to make a comment because I cannot actually see that part of the screen.
All right. It does look like we have one individual who has requested public comment. Daniel Robinson, give me 1 second while I get that timer back up again. All right, Daniel, you'll be given 3 minutes to speak and a 10-second warning. I'll be requesting to unmute your microphone now. All right, and you are unmuted.
Thank you for allowing me to comment. I'd like to address item number 4. It was mentioned earlier how the board and schools of pharmacy work effectively together. But here you've added an educational requirement for our students without consulting us. And this is, it's a race at the beginning as students come into our programs to get them ready so that they can be put into pharmacies and in their early introductory pharmacy practice experiences. So getting their license, getting everything signed, all the paperwork, all of that is an absolute race when students come on. So putting additional barriers there is going to be problematic. Every student who works with a pharmacist, it's the pharmacist's responsibility to ensure that anything that the intern does is appropriate. Plus, I believe that all schools, the first things they do with the students is we have coursework that gets them ready for their internship responsibilities. So they learn law very early in their curriculum, and then they learn it throughout as time progresses. But they get a very quick introduction early on. So I would like to know exactly what problem we're addressing by adding another requirement And if you can't identify a specific problem, then why add this as a solution? Thank you.
All right, and that appears to be our only individual who has requested public comment. Would you like me to close that Q&A panel?
Thank you, Sarah. And thank you, Trisha. Any comments from members? And then we're ready for vote. All right, we're going to go for the vote, starting with Debbie. Debbie
Yes.
Veal. Thank you, Debbie. Jason Wise.
Yes.
Thank you, Jason. Maria Serpa.
Yes.
Thank you, Maria. Jig Patel.
Yes.
Thank you, Jig. Cheryl Butler.
Yes.
Thank you, Cheryl. Jose De La Paz.
Yes.
Thank you, Jose. Shirley Kim.
Yes.
Thank you, Shirley. Ricardo Sanchez.
Yes.
Thank you, Ricardo and Nicole Thibault.
Yes.
Thank you, Nicole, and I vote yes. The motion passes. We are moving to last
Yes.
one, and it's organizational development. Back to you guys.
Thank you. So we are on our last goal area. The summary is on pages 35 to 36 with survey responses on pages 430 through 473. And we will go ahead and look at the pre-written objectives. So looking at that first one, is that something that we want to keep?
Yes, I would say absolutely.
Okay. And then the second one.
Yes.
Okay. And then how about the third one?
Definitely.
Okay.
And definitely number 4, we definitely want to.
Okay.
Do we need a BCP for number 4, Anne? Or President now?
I think it's.
We
Go ahead, Anne. Yeah.
I think that number 1 is kind of intended to address any resource needs that we're going to have throughout any of the objectives.
So that it's kind of umbrella. All right. And everything is
I believe so.
Okay.
Yeah.
Okay. So looks like we're good with all 4 of these. And then next we would have the suggested objectives from the environmental scan. So we can consider whether or not we want to include those as well. So let me read those as Sarah types them. So the first one is develop staff through training and setting clear expectations to increase staff retention and support staff. I think you might have covered that with your previous objectives. It's stated a little differently, but I think the same goal will be accomplished, but we'll leave it there for now. Second one is improve public and licensee access to staff to provide better customer service and support licensees. And then the third suggested objective is strengthen communication with board members regarding day-to-day operations and by seeking more feedback from board staff. And Sarah, if you need me to reread anything, please let me know.
I've got them up on my screen,
Okay.
so I'm just
okay.
Retyping.
Okay.
I'm trying
Does
to figure out
anybody
what
remember the environmental comments that led to the third one on the screen? I think I just need to know some background. There are 2 different issues. One is about more feedback from board staff, and one is more communication about day-to-day operations. What's that mean?
So there was more than one board member that it just expressed that they'd like to know more about the day-to-day operation, what's going on at the Board of Pharmacy and would like to hear more feedback from the board staff.
I didn't say feedback about what? Or is that just more information, not feedback?
I think it was like in general, for like, you know, from the various units, just more input from the board staff.
So Anne, I have a question for you. Is this similar to what you had talked about, having more either email or board reports from your different departments? Is that similar to this?
I think it's a little hard for me to say, Maureen, because I'm not the person that made the comments. So I think I would read this as what we're currently doing, more members would like more of. And so I don't know if some of that is augmenting the quarterly reports that we provide or the emails that I send out to members, those kinds of things.
I'm actually reading it that the board members want to hear more from board staff. I mean, I think we are well communicated by Anne. I think she does a great summary. I think she does a great communication, but it seems like it's talking about people other than Anne, that the board members want to communicate. I'm not sure what communication means, but that it says more feedback from board staff. So I'm thinking it's other than Anne.
I would be careful with as far as staff, they do have, what do you call it, rights and so forth. And I'd hate to go down there and muddy the water for supervisors and so forth. If we're going in there and we're on the pharmacy board and we're asking them to do certain tasks like to research or whatever, and we're going to look over their shoulders, that's my only concern. And somebody could get offended by the way we talk to them or whatever. I don't know, I'm just bringing that up because that would be my concern.
No, you're absolutely right, Ricardo. I think that would be my concern. I think it's kind of recommended for our practice to go through Anne just because that's how we are set up. So I feel like this is, I mean, I'm just being my opinion. I think this is unnecessary, but again,
Okay.
it's
Yeah, and I'm just saying it, somebody could be intimidated. They could say, why are you picking on me? I'm one of whatever employees, and you're watching over my shoulders, asking me something specific. That's intimidating enough to me. That kind of stuff. I'm not saying it's going to happen, but it could. And do we want to expose ourselves to that?
I don't think that the communication is that way. I don't think it's board members calling up board staff. And I don't think I'm the one who did this, but I'm kind of trying to read between the lines. I think it's the other way, Ricardo. I think it's a board member, and it must be more than one, said something. I want feedback from the staff.
Yeah.
So I don't think it's the board members coming and saying, hey, I want you to do this, or, to call staff members. I think it's more, feedback from the staff. That's how I'm reading it. I'm reading it the opposite.
And if we if we did that, I mean, I would definitely if that's where we're going to go with it, I'd recommend that several board members go together.
I'm not trying to.
No, we're not going anywhere.
Okay.
I think it's just, once again, I'm thinking that some people are wanting feedback from staff members about stuff. I don't know. I'm actually trying to look through the comments to see if I can
I know we have, like, when we ask for certain information, they do go out and gather it, and they come and present it to us. I mean, if you're talking about specific units, I'm sure we can, through Anne, can have one of the
not trying to put anyone on the spot, but do we feel strongly enough where we need to keep this? Do we need to keep
I
this?
don't.
I don't think it's
I think it does a good enough job. The 8 years I've been around, any questions we have, I mean, I don't see that we can't direct.
It's never been an issue.
I'm looking through the scan trying to find where this even comes up, to be honest with you, so that I can better understand what people were saying.
And maybe I'm not reading it right. I mean, let's,
It sounds like there's a lot of confusion around it, so because of that, it's probably best to leave it out if it's subject to misinterpretation.
Let's just move on.
Yes. So it seems like number 5, and then on the previous screen, there's one, let's see, number 3. So 5 and 3 seem similar. So I just want to see if we want to keep both of them.
On that one of the differences that I see between 3 and 5, and maybe it's folding one into the other, is the expectations piece.
Okay.
That is not, so 5 doesn't speak to the expectations piece. So I don't know where members feel about that, but maybe in folding that in.
Okay. And I'm not trying to get rid of it. I'm just want to create that discussion.
As a follow-up, I did find the information, Debbie, that looked like it may have brought this, and I think there might be some confusion. The comment that I read that kind of describes it is board needs to know a little bit more about what's taking place in administration. And I think that's talking about in DCA, not at the board.
Oh, that actually clarifies things, Maria. Thank you. Thanks for finding that.
And we do get a DCA update, but maybe people want something more or different from our DCA update.
I think that's just something that we can communicate with Anne, so I don't think that needs to go on as a goal. I mean, as a strategic objective or whatever we call it. So.
Okay.
Makes me feel better.
All right. So are we good with keeping 5 then as it is? Just keeping 5?
I think 5 has its purpose in my opinion, so I think we should keep it, but I'm open to suggestion.
I think I like all 6 of what we have here.
Okay.
And we should vote.
Okay. Excellent.
All right, sounds good. Anyone willing to make a Cheryl? Do you want to make a motion?
Okay, my motion is that we're good with the 6 recommendation for the organizational development and
and delegate to the board president and staff the authority to make any non-substantive changes to the language. Is that okay? Sorry, I'm not trying to.
No, I appreciate the help. Thank you.
I'll second that.
Thank you, Ricardo. Thank you, Cheryl. Awesome. All right, we're gonna open up for public comments.
All right, so if any member of the public would like to comment on this goal area, please type, "I would like to make a comment," using the field in the lower right-hand corner of your screen, and submit it to all panelists. We are displaying instructions for your reference, and we'll give you a moment. And again, I say that, but I'm relying on Sarah to see who wants to make a comment.
All right, I think that's enough of a pause. It doesn't appear that there are any requests for public comment. Would you like me to close that Q&A panel?
Yes, please. Thank you. Thank you, guys. And we're going to go for the vote. Last vote for the day in an open session. So we're going to start with Debbie Veal.
Yes.
Oh, sorry. Yeah, okay. Go ahead, Jason.
I know I got to go first twice. Woo!
I know, it's okay.
Special sister.
Thanks,
Jason Wise. Jason? Jason? Sorry, did you say yes? I'm sorry, I'm not hearing.
He nodded yes.
Oh, okay. All right, Jason. Is that okay, Eileen? We'll take. Jason votes yes, per visual guidance. Maria Serpa?
Yes.
All right, Jig?
Yes.
Thank you, Jig. Cheryl?
Yes.
Thank you, Cheryl. Jose?
Yes.
Thank you, Jose. Shirley?
Yes.
Thank you, Shirley. Ricardo?
Yes.
Thank you, Ricardo and Nicole.
Yes.
Thank you, Nicole. And I vote yes. Motion passes. All right. Thank you so much, everyone. And Miss St. Clair, just want to describe, what the next steps might be, and then we'll go for the closed session.
Yes. So real quick, what I'm trying to do here is show you your grand total of objectives. It's actually not so bad. It's quite reasonable. And then, let's see here. So that gives you a total of 39. So for that many objectives, what would you think, how many years do you think it would take you to achieve 39 objectives? And generally, boards choose a time between 2 to 5 years for their strategic plan.
I think 5 years.
I would second that.
Anyone else?
Reasonable.
Okay.
4. Should, ideally it would be a 3-year plan and revise that 3 years, for the next, 3. 5 is, it's way out, I think, if it's 5, but, 3 would be ideal if we could accomplish those in 3, but I know it's aggressive.
I think unfortunately, Jose, the pharmacy things move very slowly. So
That's why I'm open to 5. Just keeping that in mind.
Yeah.
Tricia, what was our last one 5 years ago? When was our last one?
2016.
Yeah, your last, yes, 2016.
I think a 5-year cadence sounds. But Anne, did we push this a year because of COVID, or were we planning to do it 4, or are we typically 5?
I think the plan was 5 years last time.
Okay. Yep, I'm with you. So 5 years.
All right. So next step will be we will provide a draft of what you came up with today. The board will approve that draft, and then once that's done, we can arrange action planning, which will take place with the board staff. So thank you, everyone who participated today, all of you, thank you.
Thank you guys. Really, really appreciate your time and doing a wonderful job. And thank you to all the members and also the public who observed and participate in the meeting today. And we're going to go to closed session as indicated on the agenda. The board will convene in closed session to deliberate on disciplinary and other matters. As indicated on the agenda, members will reconvene in open session to adjourn the meeting in open session. That portion of the meeting, however, will not be broadcast due to technological limitation. No board business will be conducted. Thank you all for participating today. Members, we will begin closed session in, let's do 15 minutes at 3 o'clock, and we will be terminating the WebEx to allow members to convene in closed session. Thank you, everybody.
Thank you.
Thank you.
And you should have all gotten emails from Debbie Dameth for the link. As if anybody has, please contact Debbie if you need to.